CNAR's discussion series about coping with COVID-19. We will be doing a number of these sessions. This is our first one, and this is on regulatory examinations. We have, when we put out the invite, we had an incredible, tremendous response, over 200 individuals, participants interested in attending and listening. Therefore, we've changed up the format and invited some key speakers to facilitate and discuss among themselves what is happening. So we'll start with that. Katya has agreed, the CEO of Canadian Alliance of Physiotherapy Regulators, former chair of CNAR, and somebody who is actively and committed to the best practices with regulators, has agreed to, thank you very much, Katya, to be our foreperson on this panel, and has pulled together some strong players from a diverse background who will discuss among themselves some of the key issues that they're facing and the solutions that they're providing. So we'll have about a 30-minute, 40-minute talk between the team. We will then open it up to questions. You'll see a chat function on the bottom right-hand side of your screen where you can pose some questions to us, and we'll begin for the last 15 minutes or so. We'll begin asking the panel some questions. So thank you again, everybody, for joining, and Katya, if you could start us off.
Thank you, Allison. Alana, before I begin, there is a message on the chat line that quite a few people are waiting on the other platform. Is that something that we could address or maybe try to fix before we begin? I'm not sure how to fix that. Okay, I will leave that with Alana, and because we don't have a lot of time.
Sorry about that. Yeah,
That's
sorry
okay.
about that, Katya. I was just on mute. I will call into the other line on the Uber conference, and I will ensure that everyone knows where to go. Thank you.
Okay, and thanks, Chelsea, for bringing that to our attention. So we'll, it looks like Chelsea's also sent out a notice, so I appreciate that. Great initiative. So thank you, everybody, for joining us. As Allison was saying, you know, when we first came up with this idea, I thought this was going to be an informal conversation between myself and my 15 closest friends and fellow exam geeks. And it is not that at all. It's turned out to be so much more. So obviously, what this is telling us all is that we need to talk. So I welcome all of you, and I will just get going by telling you a little bit about what's going on in my neck of the woods, and then we'll share some stories and other perspectives from the other members of the panel. So as Allison mentioned, I'm the CEO of the Canadian Alliance of Physiotherapy Regulators. We run all of the licensing exam for all of the regulators in physiotherapy except for Quebec. And we have two types of exams. We have a written multiple choice exam, which is a computer-based exam, which is delivered across the country, same date, more or less same time, through computer centers. And then we have a performance-based OSCE exam that's delivered twice a year in large generally university centers. And because of the limitations on people gathering, because of the limitations on facilities and closures of facilities, we have had to postpone our upcoming exams. So at this point in time, we've made the decision to postpone our written computer-based exam for May and for July. And we've decided to postpone our June performance-based OSCE. Currently, we're really, really hopeful that we'll be able to begin operations again in September. This is based on a 6-month epidemiological curve, which seems so far to be holding. If you take a look at some of the modeling that's been going on through some of the key schools of public health. So, you know, fingers crossed that by September, things will be a little bit more normal. But in the meantime, like many of you, we are trying to make some decisions about what these delays might mean for the broader physiotherapy community. So the way we've been handling that at the Alliance is by having these conversations with what I call my powerful triumvirate. So we speak with our regulators probably once a week, sometimes twice a week, to understand their legislation. As with all of you, each province is different in terms of just how flexible the regulator can be. They're different in terms of how quickly regulators can make changes to provisional licenses or other registration requirements. So we really want to stay in touch with all of them to understand how the timing of our exams may affect them and how their regulations might affect us. We're also talking regularly with our academic training programs. Because physiotherapy involves clinical placements, those clinical placements take place in health facilities, some of which have been closed because they're standalone private practices. Others can't handle clinical placements right now, so most of our programs have closed their clinical placements for right now, and they're having to completely rejig their training. So we need to understand how that will play out in terms of how we reschedule our exams to later dates, while still also taking into account the needs of our internationally educated folks. And then finally, the third leg of this triumvirate, or the third part of my pyramid where we're talking to constantly, is other exam delivery providers. So in the OSCE world, there's a limited number of centers that can provide performance-based exams in a high-tech kind of a way. And those of us who have large numbers, we just sort of descend, and if we take up all of the dates, nobody's going to be functioning properly. So like those toilet paper hoarders, we want to be thinking about the broader community and not just about our needs. And so I am frequently in conversation with other organizations that have Canada-wide performance exams, and we're trying to figure out how to stage and phase the OSCEs in a way that won't overwhelm that system as well. So those are my introductory words and the perspective of what's happening with physiotherapy. I'm going to now turn it over to Christine and call on Christine for some thoughts. Christine does lead the assessment program for medical laboratory technologists, which is a health profession that is sorely needed during the time of a pandemic. So Christine, over to you. And, really interested in hearing what you're thinking, especially as pressure mounts to get more medical lab techs out into practice. Take it away.
Thank you. Yes, so thank you for the introduction, Katya. Indeed, lots of the COVID-19 tests, presumptive and confirmatory, are being done by medical lab technologists in Canada. And so I would say we were fortunate that we ran our February exam. Everything was, remember back in February when things were normal? We ran our February exam. We were able to get through our method of validations of our exam. And just last Thursday, we were able to release, I'll speak to Ontario alone, 148 new practitioners onto the market, which is great. Now leading to the next panic stage, which is June. So we run the national exam just like Katya's organization under contract to the regulators across Canada. And in almost all cases, a certified practitioner has to do additional criteria to meet the registrar's requirements to practice in the province. And just like Katya, our folks have been pulled out of the clinical placements, some as early as a week ago and some as late as a month ago. So it depends on where you were in the province, where your students were, what the impact was. Because some areas of the lab had not been impacted yet because COVID's tested at certain places, certain spaces, and certain people or personnel are needed to do that testing. So your average lab out in a community-based hospital had yet to be impacted. So everybody was withdrawing their students from clinical placements at different times. So that, of course, will impact who we expect to usually come in June. It's our largest cohort. Usually about 900 candidates come. So that number is going to be significantly impacted for each of the disciplines. So I would say we run computer-based testing, multiple choice, single day testing, a few time slots over the day. And we traditionally test June, October, and February. So 3 times a year. My contracts with the regulators state minimum of 3 times a year, which is good language to have in a contract because it gives us some flexibility during a time like this to see if we can ramp up additional testing at a time when nobody knows when are we allowed to gather again? Are we gathering in 10s, 50s? Are we back to stadiums? And how long will that take? So I think there's a lot to be left in the unknown. We're getting regular updates from our computer-based testing vendor, but interestingly, they were working on a 30, 60, 90-day strategy, and my June session is outside of the 90-day strategy. So I'm not yet in the, I'll say, area of most concern for them, but it's coming because I believe that the June testing will be suspended now. So even about a month ago, we'd started to let them know that we would be seeking additional dates in both August as well as September, knowing that student clinical placements would be ending at different times. And just like most of you, our students have to finish a clinical placement in order to get their diplomas or their degrees in order to be eligible for exam. So a stoppage or a delay in clinical placements is absolutely critical to eligibility to exam. So you can't go to exam until you've finished your accredited program. One of the things that's exciting about being in a computer-based testing world is the possibility of opening multi-day testing. We have not needed to explore that before, but in conversations with our regulators, we'll need to make sure what's our collective comfort zone. One of the topics that we'll talk about later today is remote proctoring, and that's been something that has been a hard no for us, even while we moved to computer-based testing a year ago. And I would say we're in information gathering now because, as Katya said, our best guess is 6 months from now is when we get back together. But what if it's a year? We can't hold back 1,500 practitioners from finishing and going into work because not all of my regulators have temporary or provisional licenses either. And when you consider on our national exam, only 82% pass the national exam, that's domestic. We can't just let the other 18% go to work with full licenses, in my opinion. But we're also in emergency time. So those will be conversations that we need to have with our regulators as well. So I think I'll stop there. I know there's lots of questions coming.
Mm-hmm. Okay, thanks, Christine. So it does occur to me that those of us who use the same computer based delivery company will also be competing for the same dates in August, September, and October. So again, that's going to require a lot of collaboration and coordination to make sure that we can all start catching up with our CBT testing. And I hope we return to the multiple day testing and the question of how do you use different forms, or can you reuse forms at a time like this? So we'll bring the psychometric perspective in on that maybe a little bit later. So now let's turn to Kevin Taylor. Kevin is the Registrar of the College of Respiratory Technologists in Ontario. And we know that you've recently had to make an announcement about some changes in the way that your students are being registered and how their clinical placements are affecting registration. So why don't you tell us where you are with that, provide an update for those who haven't heard yet, and a little bit about the thinking that went into making that decision.
Sure. Thanks, Katya. As the sitting chair, I'd be remiss if I didn't add my welcome to everybody who's on the call. More than half of the participants on today's call are not active CNAR members. So welcome to the community. This what we're doing today, this is what CNAR is all about. So good to have you here. Let me start by talking about what a respiratory therapist actually is. And I find the best way to do that is look at a sort of an airplane analogy. Many people can understand how a wing works, how it generates lift. People can understand how a jet propulsion engine works. And then some of the more engineering-oriented people can understand how the dashboard works and the instruments and the indicators. But it really takes that pilot to understand both sides of that equation and put it all together. And RTs are kind of like that. You know, many people understand lung function and the pathology of a disease, and others are more biomedically oriented, and they'll understand the various controls on a ventilator, but you need a trained operator like an RT to bring both sides together and apply that technology. And so when we're looking at HHR strategies, there are several professions which practice on one side or other of that equation, but in general, they're going to need additional training to get up to speed. So that's why there's been so much focus right now on respiratory therapists. Now, we've been watching the global epidemiological data for COVID, and globally, about up to 10% of all patients require critical care, and a good number of those require intubation and ventilation. So in addition to considering whether we've got enough critical care beds and enough ventilators, we also have to be thinking about whether or not we have enough RTs. Currently in Ontario, I think we're sitting at about 4% of all COVID patients are intubated right now. So that's again, something that we watch. As well, being a media-savvy regulator, we had to consider the narrative that we wanted to create around this. I mean, this is something that we didn't have to do 10 years ago, but we do now. We wanted to be seen as a regulator that took decisive steps ensuring that there were enough RTs to help during the crisis, all the while ensuring patient safety. We didn't want there to be an opportunity to create a different narrative, one that maybe painted us as a regulator sticking to traditional bureaucratic procedures and failing to ensure that there's an adequate supply of RTs. And just, you think of the media questions, like, why didn't you reach out to retired people? Why didn't you tap into students? So we had to be thinking about that. So anyway, we started by analyzing our current data, found that there are 3,700 RTs in Ontario, 2,200 of those are currently working in critical care. That leaves 1,500 who potential for redeployment. And our inactive, recently retired, resigned, lapsed fell around 500. So the next question was, how do we get them back into practice? And we committed to a principled approach with 3 goals. 1, get as many RTs into practice as possible. 2, use existing policies and practices as much as possible. And 3, do it all without compromising patient safety. So we've got a currency policy to guide registration of people who've been out of practice for a time, all regulators do. And we issued to everybody, a call to everybody who is in that inactive, retired, etc. group, looking for about 5 years out. That was the range we were looking at. When thinking of other potential barriers, we looked at fees as potential concern for those who are retired or haven't been working for a time. And we also tried to imagine their perspective because we've been hearing a lot of feedback about fees. And some are thinking, well, you're asking me to come back, but you want me to pay to do it. So in response, we waived application fees. We had deferred registration fees for up to 6 months. At that 6-month mark, the full year is due, but we do have a regular practice of refunding unused portions of that year. So if someone works for 6 months and then resigns, they don't have to pay for that 6 months. So we're trying to do what we can. The second consideration was going to be refreshment retraining. So that would be a concern for anyone that hasn't worked in critical care for a time. So we've worked with our professional association to develop a list of web-based resources that anyone can access to help prepare them for returning. And that brings us to students. Looking in Ontario, we've got seven programs in Ontario. There are 24 across Canada. Students typically graduate in the late spring, so all programs were actually within 8 weeks of finishing when their clinical placements were suspended. So that was fortunate. It's a 3-year program, so they're all at least 95% complete, and their entire 3rd year has been spent in the clinical setting. So in other words, they're familiar with the equipment, the people, the environment, all of the infection control practices. They're basically job ready. So in terms of numbers, there were 117 in this year's graduating cohort across the province, but there's the question of competency. So under normal conditions, the students complete their program, get signed off on all competencies while they're in the clinical setting, graduate, and then apply for what we call a graduate certificate. So it's a temporary license. It's limited to 18 months and carries some supervision requirements. Our board exam is only offered twice a year, so the certificate allows them to enter practice while waiting to write that exam. It's the usual practice. Then once they pass the exam, they're eligible to upgrade the registration to a full general certificate. So I think that's pretty typical. What we decided to do was allow students that were within 10 weeks of graduation to apply for that graduate certificate. And we could do this because our regulation actually allowed the registration committee to recognize education programs. So council passed an emergency registration policy that allowed the recognition of those programs within 10 weeks of graduation, only under emergency conditions. So in other words, not always, and it basically cuts off any arguments about this being a precedent. We also asked the schools to provide us with verification that the students were not in academic jeopardy and that they were expected, where they were expected to be in the program. So what that means is we set the cutoff at 10 weeks, but if somebody had missed 6 weeks earlier in the year, they're actually in deficit of 16 weeks, and so that would make them ineligible. So that's all that we were looking for from the school. So that didn't put them in an uncomfortable position because they didn't have to make a subjective decision about whether something was good or not. We made the students eligible for the waived application fee and deferred registration. Now, each program still has to figure out how to get the students from now to diploma, and we've had a conversation with the accreditor about that. And once graduated, then they'll be able to challenge the board exam, and only then can they become fully registered with the general certificate. And response has been good. We registered, as of this morning, 85 of 117 potential students from last week, and I've even had applications from out of province. And the media response has been quite favorable. The decision and results have been viewed favorably by the regulatory branch of government, and they're obviously receiving questions from the political arm about whether we have enough RTs. So it feels like we did the right thing. But anyway, to sum it up, we've allowed students to practice with a supervised license while waiting to finish their program, and that covers off the patient safety requirement. They'll still have to graduate from their educational program and pass a certification exam to remove the supervision requirement, and that keeps everything within the usual process and eliminates any arguments of precedent. Muted, Katya.
I'm talking to myself here in my room. Okay, now I'm unmuted. I think that's a great example, Kevin, of how you balance public interest with the need to be very flexible at a time where there's so much uncertainty and so much fluidity, which I think is the questions that, we're all trying to balance. Where do you find that right? Where do you draw the line, and where do you how do you find the balance between risk reduction and responsiveness? So thank you for that. Probably something that we'll come back to in our discussion. I'm now going to turn it over to Sten Ardal, who is the CEO of Touchstone Institute, a site, an independent site where frequently OSCEs are held, performance-based exams are held. And Sten, we know you had to close your center fairly early on in all of this. And so I'm interested in hearing from you about your thoughts as someone who runs a center and has to provide services for much needed health personnel, but also needs to keep your people safe, has to make sure that your standardized patient program is running effectively, and balance everything else. So over to you to hear your thoughts.
Yes, thank you, Katya, and thank you for including me in this discussion. I just start with just a couple of comments that I think relate to what Kevin was describing about the need to respond in a time of crisis with health professionals. We work primarily with internationally educated health professionals. We were originally created as an organization to work with internationally trained physicians. We do some orientation programming, which we've rapidly had to put into online training. And we've been involved in some discussions about how we can help getting people who've been trained as doctors internationally into potentially help if things or as things may progress. But what I want to focus primarily on is the work that we've been doing in assessment. And we run exams, almost all of them have a performance-based component. Most of them are OSCEs. We have run in the past year at 13 different locations across Canada, but we have a large site in Toronto where we do our most of our OSCE examinations. And a couple of weeks ago, we had to make the decision to shut down all of our exams till August 31st. Sorry, till July 31st. I'm ahead of myself. That's the next decision we have to make if we're going to go to August. And certainly we're thinking about that. And at that time we made that decision, we were less than 2 weeks out from a large OSCE. And we had just run in our facility on March the 7th, a large OSCE examination for the Medical Council of Canada. So things really have happened very quickly. So our kind of best case scenario right now is looking at what we can make up as we get back into business, perhaps in the fall, and how many additional dates we can add. And even with that scenario, we can't make up what we had intended to do in the current year. And our largest volume activity is with nurses, with internationally educated nurses in either communicative competency exams or evaluating exams as they're going through seeking licensure as registered nurses. So we can't make up what we're losing, and we are planning what we might be able to make up. And we're also considering scenarios that have us unable to continue exams for the bulk of the year. So we really don't know when this is going to be over. Of course, when things start to go back to normal, maybe there'll still be travel restrictions and other things that impact the kind of work we're doing, particularly around internationally educated health professionals. So I think there's going to be a tremendous amount of pressure, and certainly when you're doing exams which have a large performance-based component, it's very difficult to imagine how you could get the same kind of exam in a different way, and we're going to be seeking a lot of pressure on how to get some of these professionals into the workplace if they're needed. As Kevin has outlined, he's got a strategy that is working very well in his profession. Other professions may not be able to have those strategies, and there may be a lot of pressure certainly on how we actually get people in the workplace. So what's that going to mean? I've been trying to get some conversation going with the regulator in Ontario about, are we going to have some kind of a provisional licensure? What can we do if we get into a very tough situation? And that starts to open doors about, the assessment, complex assessment models that we've built up that have been tremendously rigorous and designed to try and ensure we have a really good valid assessment regime. Is that really going to come under pressure if we can't deliver and actually get people through these assessments and into their profession, and what kind of alternatives might be out there? And I think for some professions, the remote proctoring, there are other things that will work, but certainly in many of the health professions, the actual being able to assess the interaction in a live kind of setting has become a very important part of the assessment process, and one that I think we're going to have trouble getting back in play for a fairly long period of time. It's going to be hard to predict when we'll be able to catch up. So not many solutions there, but I think we really do have a challenge, and we'll be trying to think of what strategies we might be able to put in place to ensure we get people into the professions and doing the care that needs to occur, particularly in health, while at the same time maintaining the integrity of the examination systems that we've spent so much time building.
Thank you. Thank you for that. Those are a lot of the issues that were raised in our questions that people sent in to us. Those are definitely the questions that we're struggling with. How do you stay relevant when the pressure begins to build that maybe exams aren't needed? And, we've built our policies, our careers, and our integrity on maintaining very defensible high stakes exams. And so while Greg's going to talk in a minute about remote proctoring, I'm very interested in thoughts and ideas about, what options are available for almost OSCEs, and what is the virtual proctoring equivalent for performance-based exams. Again, I don't have an answer. Very willing to have that discussion. So thanks for starting that, Sten. So we're now going to move to Greg Pope, who is both in a completely different type of a profession and in a completely different part of the country than us four previous speakers. So Greg works with APEGA, which is the, I don't actually know what APEGA stands for, but I know it's the engineers in Alberta. And Greg also has a psychometric background. And so he'll be able to offer a different perspective. While those of us who regulate health professions are impacted one way with the pandemic, those who are working with other parts of the, in the economic sector, that's going to be our next series of concerns, is how to get the economy back up and running. So those folks are affected in a different way. And Greg has the benefit of having worked with virtual proctoring for a number of years with the engineering exam. And I know a lot of you are really interested in hearing about the ups and the downs and the challenges and the pluses of the of virtual proctoring. So we thought we would put Greg at the end so that maybe he could have a little bit more time. And then we'll turn it over to questions. So Greg, over to you. And
Great,
Greg, unfortunately, doesn't have a live camera feed. So
yeah, sorry,
you'll have to
Zoom doesn't like me.
Picture
Exactly, yeah. Thanks for the opportunity to speak today. So APEGA actually stands for the Association of Professional Engineers and Geoscientists of Alberta. So we're the regulator for engineers and geoscientists in Alberta. and I oversee a national exam, which is a requirement for licensure in most jurisdictions across Canada. So to become a licensed engineer or geoscientist in Alberta and most other Canadian jurisdictions, all applicants have to take and pass the National Professional Practice exam. So the NPPE assesses applicant knowledge of professional practice, law, ethics, and regulation. And it's 100 multiple choice questions with 10 experimental that are unscored. And they're administered in 2.5-hour testing periods. And we hold the exam 5 times a year, distributed every few months across most jurisdictions in Canada. So we have about 4,500 to 7,500 candidates taking the exam each year. So in October of 2015, when the MPP transitioned from paper to computer-based, candidates had the option of taking the exam in both brick and mortar test centers or via remote proctoring. And so we've had some experience over the last 5 years or so. Most candidates took the exam in brick and mortar test centers, but where brick and mortar test centers were not available, say in isolated locations, those applicants could take the exam using remote proctoring. And so at the start of the CBT transition, we actually had an in-person proctor and a remote proctor for remote proctored candidates because we had security concerns. But serendipitously, we had planned to lift this additional in-proctor requirement for remote proctored candidates for our upcoming June administration. And with this COVID-19 situation, we decided to lift it earlier. We actually have an exam administration happening next week, and I'll talk about that in a minute. So in recent weeks with this COVID-19 situation and closing all the brick and mortar test centers across Canada, we made the decision to expand our remote proctoring for all the candidates for our April 6th to 8th administration, and potentially June, September, and so on until things get back to normal. This decision and transition was not terribly difficult for us because we had great confidence in the equivalence of and security of remote proctoring. So we were able to pivot with the great help that we got from our partner Yardstick in a period of about 2 weeks to ensure that all the applicants who need to take the MPP to obtain this requirement for licensure could do so with no postponements. We didn't consider waiving the exam requirement. As the director of the program, I would not have been in favor of that. I think it's important to have that objective measure of knowledge, skills, and abilities through a high stakes exam. So we went with the remote proctoring option. And so what this remote proctoring option looks like and how it's sort of done is for the MPP, we use Yardstick and ProctorU, and we use the highest level of security they have, which is called Live Plus approach, which offers applicants to take the exam via remote proctoring with a webcam and a stable internet connection in their home office or den, where they would not be disturbed during the exam session. So candidates are taken through a multi-factor identity verification process and an environment security scan by the remote proctor, where unpermitted materials can be removed before the exam. And when the candidate is allowed to start the exam, they're in a lockdown browser, so they're not able to navigate to other web pages and sites and so on. The candidates are monitored live during the full exam by the remote proctor, who can flag suspicious events and intervene when necessary, even to the point of terminating the exam if needed. And then the proctor actually also has a artificial intelligence-driven software process that acts sort of as a second set of eyes, and it's constantly monitoring behaviors and alerting the proctor to suspicious activity, such as lighting changes or unusual sounds, or if the candidate is looking off the screen and so on. So all the remote proctoring sessions include end-to-end recordings of timestamps, and the exam administrators, myself, can choose to receive real-time incident notifications as well. And when the candidates completed the exam, they would submit it just like they would in a brick and mortar test center. And from a psychometrician perspective, all the data is available for analyses, regardless of how it was collected, whether it's remote proctoring or in a test center. So I thought, because there were some questions around psychometric defensibility and test security and performance equivalence and things around remote proctoring. So I thought I'd just talk about that quickly. So when we in the testing industry talk about psychometric defensibility, what we're really talking about is whether robust standards for exam programs are followed. So whether these standards are ISO 17024 or the NCCA standards for the accreditation of certification programs or standards for educational and psychological testing. These standards all contain guidelines on things like blueprints and exam specifications and item development, item and test analyses, scoring and reporting, and of course, test administration. And so it's the latter, test administration, and the security around that where remote proctoring comes into play in terms of exam program defensibility. All the other standard areas like item development are not impacted by remote proctoring. So if those areas of your exam program are following the standards, then remote proctoring wouldn't change the defensibility of your program in that regard. So the real question is whether remote proctoring meets standards for test administration and security. And my perspective, based on experience with the MPP and analyses I've run and hearing from colleagues about their research and experience, is that I think remote proctoring can meet test administration and security standards for high stakes exams if the most stringent remote proctoring security measures available are put in place. And so when the MPP was a paper-based exam, we did have quite a bit of issues with cheating and content theft. So when we transitioned to CBT, we took great care to try and mitigate these test security issues using some of the benefits of CBT, like scrambling the question order and so on. And the test security areas, such as collusion detection and content theft patrols, we regularly conducted. So to date for the MPP program, there's been no collusion cases flagged or content theft cases that have been linked to remote proctoring. All the cases have been that we've investigated have actually been in brick and mortar test centers over the last 5.5 years. There's also the question about performance equivalencies between remote proctoring methods and brick and mortar test centers. And so I conducted analyses on these as well. And I found that I haven't found any statistically significant performance differences in terms of pass rates or overall scores on the MPPE. For example, the pass rate differences between remote proctored versus test center groups is very, very small, less than 0.3%. And this finding I've found is consistent with proctoring methods, performance equivalency studies that I've seen over the past few years at assessment conferences and in research literature. And so I think if an exam program follows psychometric standards, including robust test center administration and test security standards, whether they are at brick and mortar test centers or using remote proctoring, then the program can meet defensibility requirements. Is remote proctoring perfect? No, but I think neither are exams proctored in brick and mortar test centers where test security issues like collusion between proctors and candidates or between candidates is more likely than in a remote proctoring condition. So I'll pass it back to you, Katya, if there's questions or comments.
So I see that there's two questions, Greg, that are very specific to you in the chat line, and I think this might be a good opportunity just to have you address those before we open it up more broadly. So one of the questions does relate to security, and I think this is the big question for those of us who are considering remote proctoring, because so many examples of what we hear are about remote proctoring for certification exams or other types of exams, not high stakes licensure exams. So the question that's specific from our chat line is, in your security monitoring, is there a way to see whether or not screenshots are being taken, presumably by the candidate? And then somebody else asks about how do you handle bathroom breaks, but I assume it's any kind of break. If somebody needs to step away to have a snack, if they're pregnant, or if they have, you know, insulin shots or any of these other break issues that we deal with in, you know, center break time, how do you deal with that with remote proctoring?
Sure. So in terms of breaks, those are handled via the exam settings. So you can choose in the exam to have a break in the middle, let's say, and then essentially the proctoring, like it would be in a test center, the candidate can go and use the washroom and then come back. So that's entirely up to the, you know, exam delivery provider and the exam manager in terms of how that's handled. Same thing with, you know, whether water is permissible or a snack, or if there's any kind of accommodations in that way. If someone's pregnant and they need, say, some fruit or something, or crackers or something to snack on, that can be allowed as well. We would just need to have those rules set in advance. And so actually for the MPP, we allow that. We allow people to have water. We allow people to have, you know, a little snack if they want. 2.5 hours is a long time to sit in a chair. And so that's the way that we deal with that. The other question Sorry, what was the other question, Katya?
Shots. It's screenshots.
Oh, screenshots, yes, of course. So the screenshots are handled through the lockdown browser. So when a candidate's taking the exam, their computer's completely locked down. So all they can access on their computer is the actual exam interface. The only thing they can do is answer the questions. They can't navigate anyway. All the functions like the print screen keystroke functions are disabled. So they're actually not able to do anything like that. You know, one way that someone could potentially steal content is if they had a camera or something like that set up. And that's where the remote proctoring does the environmental scan. They actually get the candidate to take their laptop or their webcam and scan around the room. And if there's things that look suspicious, like say there's you know, something that might look like a camera or have some way of embedding a camera behind the candidate, they're asked to remove that kind of stuff. So, you know, is it perfect? I don't know it is, but certainly in a test center, there's opportunities for people to steal content as well. And we see that in exam programs when we attend conferences and whatnot. You know, people have little cameras embedded in the buttons in their shirt, for example, that can happen in a brick and mortar test center. And the same thing could happen in a remote environment as well. But certainly every effort's made to reduce those kind of things.
Okay. So there's a lot of questions. Thanks, Greg. There's a lot of questions on our chat line about security, about cameras, about all sorts of things. How do you prevent bad behavior from happening? So maybe rather than focusing on those questions, we can make a note of those. I know there's a way that we can print out the Zoom chat and we can plan perhaps, Allison, for a separate session on remote proctoring. There is a comment that talks about, you know, perfection being the enemy of the good. And I do think at this point in time, it's one of the thoughts I've been having is, you know, we're going to have to do something if this goes on for longer than 6 months. And so how do we create a risk reduction approach where we can begin to be more flexible and maybe allow at this time acknowledging maybe this isn't ideal, but we need to be flexible. So what are we willing to accept? What is that calculated risk that we're willing to take at this time to make sure that the greater good is met? My perspective. So Allison, now that we finished with our presentations, and I've been reading some of the questions and trying to pose those to the participants, do you want to read some of the questions that came in ahead of time, or how would you like to open this up to Q&A when there's 200 people on Zoom?
Yeah, so a lot of questions came in, so thank you, everybody. I'm going to come back to a couple ones that I don't think might have not been covered. So I'll just open it up to the panelists and you decide who wants to take it. So one question is, how can we avoid going down the path with our regulators that will use this pandemic as an excuse to stop requiring ETP high-stakes exams? Prior to the pandemic, there have been rumblings with the physicians in Quebec about this.
So I think that's a super important question and probably one that we're all trying to deal with. Who's going to be, oh, I'm unstable. Can you guys hear me? There we go.
I'll jump in on that question, and maybe others will comment also.
Okay.
I think, yes, there's definitely a potential risk, and you mentioned physicians, and we have been contacted by physicians who, international medical graduates who are saying, you know, let us in and let us help. But the other side of that is that they haven't been able to get in, you know, going down the pathways that have already been established. So it's opening up new and different pathways once we start changing the exam regime. And certainly if you go to looking to differences in entry to practice exams, I think you're putting a huge level of responsibility on the education side to ensure that you know how people are being educated. And that will be a big challenge, certainly for people who are not educated within Canada and within accredited colleges and universities where you know what the programming is. So it opens up, I think, a lot of issues, but we may well be having that discussion down the road.
actually, you just tie into another question is, how do you have the conversation between the accreditation body and the colleges and the alliances? Who's deciding what?
So maybe I can start with that one. That's in the physiotherapy profession, I think even before we were all on full lockdown, we started having meetings that are including all of the leaders of the key professions in physiotherapy. So it's called the National Physiotherapy Advisory Group, and some of its members are on this call. It comprises of the association. It includes the accrediting body. It includes the association of all of the training programs. And it includes me as the exam provider, representative of the exam provider, and the registrars are included as well, a rep there. And so we have been talking about these issues in a joint kind of a way, and trying as much as possible to make decisions collaboratively, so that when the accreditor did want to give some flexibility to programs in terms of how accreditation standards would be met, there was a joint decision that we wouldn't change the standards, but we would be flexible in how they were demonstrated. That was acceptable to the other members of our profession-wide group. And similarly, as we're beginning to talk about how do we begin to schedule our exams going forward, same kinds of conversations are taking place between the regulator, the accrediting body, the university programs, and us on the exam side about when students will be allowed to access exams and when should we be thinking about rescheduling them so they meet a broader perspective and the broader needs of the community.
Okay.
Any other professions? Do you want, Kevin, do you or Christine, do you want to comment on that? Nope. No.
Sorry, looking for the mute button, right? So Christine from CSMLS. We have a pretty flexible model with Accreditation Canada anyways. We don't count number of hours and that kind of thing. So I think that the biggest challenge though with a pretty flexible accreditation system like that is that all competencies need to be met somewhere throughout didactic and or clinical placement. It's really local discussion, right? Because we have some clinical placements that are 17 weeks and some that are 42. So those are not the same kind of program anyways. So I think that's the hard thing is we wouldn't be able to, unlike Kevin, who's everyone's in the clinical placement at the same time for the third year. We don't have that. We sometimes have people going out for 3 or 4 months at a time throughout 3 or 4 year programs. So I think that's going to be a conversation that will have to happen with each of the 25 programs.
Yeah, and on our end, one of the first conversations that I had before I reached out to the schools was with the accreditor to say, you know, how are you feeling about this, and letting them know that that we were prepared to be flexible in what we were viewing as requirements, so that everyone at least was feeling like they had a little bit of room to play with. And you know, on another level, I can't help but think that every educational program, all of us, have spent years refining our processes until it's a finely tuned machine. The world's falling apart right now. If we get to pretty good, I suspect it's probably not that bad. So I think a little tolerance and a little flexibility is going to go a long way in a time like this. Mm-hmm. I also think there's two phases of time when we're talking about trying to get people, like a scenario that I was describing, trying to get people into the workplace now to deal with surge. I think you bend rules. I think you put a lot of things on the back burner. Once this is passed, I mean, we have the flexibility of having someone in a temporary certificate for 18 months, so we've got a little time to play with. But you know, we can extend that, and I understand that it delays things for people that want to be unfettered and have no restrictions and be able to do full practice. Mm-hmm. It's an unprecedented time, and so I think things are going to be a little bit different going forward.
I have noted. Go sorry, ahead, Alison. I was just going to say that I've noted that there are a number of professions that are allowing people to have temporary licenses as long as they take the next available exam, whenever that may be. And that's another way of making sure that the pandemic isn't used as an excuse, I think, to wipe everything away forever.
Good point. Another question is, if everybody goes to the remote proctoring, does anybody have a sense, and maybe this is you, Greg, have a capacity, if everybody goes that way? Is the capacity there to handle the influx?
Yeah, so, I mean, I think so. I mean, vendors would probably be better positioned to answer that question, but like what we found is we had, you know, almost 600 candidates that were rebooked at the last minute into a remote proctoring session starting Monday to Wednesday of next week, you know, within a 2-week period. And apparently a lot of people, a lot of organizations across North America were doing the same, and the world were doing the same thing. And Yardstick and ProctorU didn't have a problem with that volume increase. I think their capacity is quite robust. And I'm sure other vendors are similar. One thing that we have noticed though is that we had some questions or concerns from candidates about internet connectivity, because with everyone working from home, there's, you know, telecommunications providers are quite challenged with this right now. You know, I've noticed in my own home, you know, that the internet hasn't been as strong as it has been, you know, a month ago. So that is a concern. So technical issues that occur during the exam, I mean, technical issues occur in brick and mortar test centers too. I suspect that there'll probably be more in this remote proctoring context with COVID-19, but those are handled, you know, through rebookings or getting a session back up and running, you know, when the internet connection is back up and running. So, you know, hopefully we don't have a lot of those issues in next week's exam administration, but I'm sure there will be some, and they'll be handled like they would be in other contexts.
Okay, we only have time for a couple more questions. If a profession is requiring an exam for the first time this year, what would be your advice? Nothing. Silence.
It's hard to know where to start, right? Like if you're requiring it for the first time this year, but you can wait till the fall, it might be a little bit easier than trying to require it for the first time this year now, where facilities challenges would add a level of complexity that you wouldn't have to face if you could start a little bit later in the year. I think that might be one place to start thinking about this. Because our hands are tied, not as regulators or as exam delivery people right now. They're tied by provincial rules about people gathering together. And they're tied by provincial and federal rules about facilities having to shut down. And depending on which province you're in, you know, greater or lesser involvement of the police in terms of enforcing that. So I think, you know, from my perspective, my advice would be see if you can wait a little bit, at least not in April, like see if you could at least wait till June or July when things are a little bit more clear. I think I would start there. Sten, do you have any thoughts on that? Not to put you on the spot.
Well, if it's a first exam, I'm not sure what the situation is, but maybe what you did before might work for now until you're able to launch the exam. But certainly at this point, you have no choice but to wait. If your plan had been to do something within the next 2-3 months, well, that plan's just not going to work out. You're going to have to come up with another one. And I would say, given the fact that people have to arrange to be at exams, there might be travel involved, there might be other arrangements, you really have to give that time after things get back to normal for people to arrange themselves to be able to attend an exam. So I think you have to be fairly conservative in the estimate of when you might be able to get an exam running. And right now, I would say you could maybe plan for the fall. I think summer's optimistic, but I may be wrong. I hope I'm wrong, but it may be hard for timing-wise if you need to give people time to get organized for an exam date.
Yeah, I think we're all hoping that this is over sooner rather than later. Final question, I think. Greg, could you share some details, information about the number of appeals filed related to technology issues with the remote proctoring process? Do you have any data on that at all?
Yeah, absolutely.
Off
It's
the top
funny.
of your head?
I was actually just writing a response, but I can just say it. So in terms of appeals, we haven't had appeals for remote proctored exams to date, but I believe that's because the majority of exams that have been conducted have been in brick and mortar test centers to date. So now that we're transitioning, at least for the foreseeable future, to remote proctoring, we could get more appeals. The appeals that happen for the exam, for the MPPE, are more along the lines of rescore requests. We haven't gotten appeals for things like, conditions that cause the candidate to not be able to take the exam properly or demonstrate their competence or their knowledge, skills, and abilities to the full, capacity. So we haven't had any for remote proctored yet, but I think that we will have some appeals or questions that come up now that we're expanding this to all of our candidates.
Okay, excellent. Kevin, there was a comment that you speak too fast, and they wanted a summary of yours. So I don't think we can cover a summary here, but I wanted everyone to know that this call is being taped. I should have said that at the beginning, so my apologies. And we will be making the audio tape available for everyone, posting it on our member portal. Okay, and those of you, we have opened up the portal for non-members because it's very critical during this time that we support the entire community. So if we haven't registered you yet, just contact Alana, and she is registering everybody as fast as possible. I did take note down, we had over 200 attendees today, which is fabulous, and I wrote down the note that you made, Katya, that maybe we do need another session on remote proctoring. We do have our second discussion is this Friday on human resource managing the teams during this difficult time. So if you haven't registered for that one, that is our next 1 hour session. And we also have sent out a questionnaire asking what are the other topics that you would like for us to try and facilitate and bring together a panel for this type of forum. We will also be sending out a questionnaire, just getting your feedback, how this works. Do you like it? Does this support you and being a success in your day job? So thank you very much to the panel. Thank you, Katya, for being our excellent facilitator and champion, and thank you everyone for attending. Speak with you soon.
Allison,
have a great day.
Before we go,
Yes.
can I just ask one more thing? If those of you who are interested can provide an update of your organization or your profession and what you're doing with your exams, I'm assuming that a lot of people have had to postpone or cancel. We're going to consider the possibility of putting a summary document together where we list the profession and the organization and sort of what the plan is in the near future. And then we'll try to collate that and share that as a written document as well. So if you can get that to either Alana or to me directly, we're going to work together to create a document for you.
Great point. Thank you, everyone. Have a great day.
Thank you. Bye-bye.
Stay healthy, everybody. Take care. Bye-bye.